Whether it's providing reliable research and health recommendations, providing much-needed supplies, or the trusted guidance of our next guests, we rely on our federal partners for help. That's why I'm pleased to have Dr. Anthony Fauci joining us by video today. I'm a big fan, and he's someone I've been so impressed with over the last 6 months. He tells it like it is, and in a way that most of us can understand, much like Dr. Levine. For most, he probably needs no introduction, but I'll give one anyway. Dr. Fauci is the director of the National Institute of Allergy and Infectious Disease, where he's led our understanding of HIV, AIDS, Ebola, and Zika. And he's advised 6 presidents on these global public health issues. He sits on the White House Coronavirus Task Force, and I'm sure many of you have seen Dr. Fauci sharing his wisdom on many national programs. As I alluded to before, I know I've really appreciated his leadership and expertise during these difficult times. Dr. Fauci, if you were here in person, we typically would try and sweeten you up with our world-class maple syrup, or maybe even a maple creamy, which you probably know is a soft-serve ice cream. But I appreciate you being here with us today, and we'll turn it over to you to say a few words, and then hopefully take a few questions. Dr. Fauci.
Thank you very much, Governor Scott. It's a real pleasure to be with you today, even be it virtually. But I do appreciate you giving me the opportunity to join you today in this briefing. I'm particularly pleased about being here because what you just mentioned in your introduction is what I have been trying very hard over the last several weeks to months to communicate to the nation about how we can actually open up our economy, get our children back to school, get people back to work in a safe, measured, prudent way. And there were certain parameters that would make that easy. And I was sitting here listening to the numbers that you said, and I would wonder if I could bottle that and take it with me when I go around talking to other parts of the country. I think one of the things you said in the beginning that's absolutely critical that I have been emphasizing now for some weeks, in that the success of being able to prudently open is the baseline from which you start. In other words, you are trying to open up, you're getting your children back, you're getting people back to work. When you have a test positivity of 0.2%, you are starting the game on your side. And when you do that, you also mention things about school. You want to have some in-person instruction. And when a child gets infected, which inevitably will happen, you have a plan how to respond to that. So it isn't an all or nothing phenomenon where when you get a minor setback, you don't have to turn the clock back. So I want to congratulate you and all of the officials in your state who have been responsible for this plan and the implementation of it in a very prudent way. I believe strongly that if we do what you've been doing in Vermont, in the rest of the country, although it's different, as you well know better than anyone, that Vermont is different than other regions and sections of the country, but nonetheless, there are some commonalities. And if we adopt the commonalities that you've done, I believe that as we enter the fall and the winter, which will be a challenge because there'll be much more indoor activity as opposed to outdoor activity, that we can not only get through the fall and the winter, but we can come out on the other end better off than we went in. So again, thank you very much for giving me the opportunity to make these few comments, and I'd be happy to join you in answering questions.
Thank you very much, Dr. Fauci. We'll start with Calvin from WCAX.
All right. Thank you, Dr. Fauci, for coming in today virtually. I wanted to ask you about rapid result testing. I'm wondering if you believe that rapid result testing is reliable and if it has a place in a state like Vermont where we have such a low COVID positivity rate and also a low COVID case count.
Oh, yeah, thank you very much for that question. Yes, the rapid result has a place, particularly when you're trying to do screening of opening up whatever, or screening a nursing home, or screening a prison, or a meatpacking plant, or a place where you need to know something that might not necessarily have a 99% sensitivity, but if you do it enough, then you have a degree of certitude that you are going to ultimately pick up individual cases within a group. Let me give you an example of what that would be. We have a rapid result testing whenever we walk into the White House. So let me look at my watch, about 2 hours from now, I'm going to be going down to the White House. And before I enter, we need to know generally whether I'm infected or not. It isn't like I have a risk. I've not been exposed to anyone. But in order to find that out, we can't wait 24 to 48 hours. So when you're dealing with screening, it is a very, very good test. As you mentioned, Vermont, with such a low test positivity, likely does not necessarily need that in a critical way. But if they do want to do broad general surveillance, it could be a good mechanism to use, particularly the most recent tests, which have a higher degree of sensitivity and specificity than the first generation tests. Thank you.
Thank you. Liz from NBC5.
Hi, Dr. Fauci. As you know, cases have remained pretty low here in Vermont, but I'm wondering if you have any advice for Vermonters as we, anticipate a potential second wave of the virus in the winter.
Yeah. Well, yeah. My recommendation would be to do the kinds of things that you are doing. One of the important lessons, and I'm glad you raised the question that way, that even when you are in as good shape as Vermont is, you got into good shape by certain things that you've done. Don't get careless, and I don't expect that you will, because there's no indication that you've done that, but be prudent and careful in your interaction in the community, because if you let your guard down, they're unquestionably, because people come in and out and will be coming into Vermont from states and regions that have a higher degree of test positivity. I don't think you inevitably are going to have a second wave. And this really relates to what I said a moment ago. It's going to be challenging as you get into the fall and the winter, but it doesn't necessarily mean that you're going to have a problem if you do the kind of prudent public health measures that you've been doing.
We'll now go to Steve from Local 22. Oh, sorry. Jolie from Local 22. Okay, we'll come back. Oh, go ahead.
Oh, thank you so much. Hi, Dr. Fauci. Thank you so much for your time. With the seasons changing and it being a popular time to travel to Vermont, how should the hospitality industry, like businesses and hotels, continue to operate safely?
Well, very good question. I mean, Vermont is certainly a very popular place to visit, particularly in the fall, and also winter with skiing and a variety of sports that you have. I think that the hospitality industry should do the kinds of things that I've been saying, essentially in a very courteous way, the way Vermonters do, is demand the kind of care to public health measures that you have. For example, for someone to come in from a place where there may be a high degree of infection, I think mask wearing should be something that's quite consistent, particularly when you're in a situation where you don't really have any idea of the test positivity of people who are coming into your community. So obviously you want to be courteous and welcoming, but you also want to have a degree of protocol that I think safeguards not only the people who visit, but certainly the inhabitants and the people who do live in Vermont. So I think a good degree of caution without being over restrictive would be the way to go.
We'll now go to Wilson from the AP.
Thank you. Hi, Dr. Fauci. Welcome to Vermont virtually. You talked earlier, and we here in Vermont are accustomed to small numbers on everything because we're such a small state. Do you think what the practices and procedures and protocols that Vermont has been using to keep these numbers so low, do you think those can be translated into larger states?
Yes, absolutely so. I mean, some of the fundamental principles, regardless of your size, are things that would hold true because these public health principles don't really change. I mean, you can apply them to a different degree. But, I've been speaking about the 4 or 5 fundamental principles when you're in a situation where there's active infection in the community. Universal wearing of masks, keeping physical distance, 6 feet being the parameter with some variation, avoiding crowds, doing things outdoor as much as you can do indoor, and washing hands as frequently as possible. Whether you are in Vermont or in New York City, downtown, those things work. They work in states with small numbers, like Vermont, and they work in states with big numbers, like New York and Texas and California. So that's the reason why, as I was mentioning to Governor Scott a few minutes ago, that this should be the model for the country of how you've done it. Notwithstanding that you're a small state, but it should be the model of how you get to such a low test positivity that you can actually start opening up the economy in a safe and prudent way.
Okay, thank you very much.
We'll now go to Kevin from 7 Days.
Thank you, Doctor. Can you hear me?
Yep.
I appreciate you being here. On the subject of Vermont being a model for the rest of the nation, Governor Scott imposed a mandatory mask requirement on August 1st, and he did so after much reflection and hesitation about doing so out of a concern that perhaps education was a better path forward. Do you think there should be a national mandate? And if so, do you think Vermont's experience with a mask mandate would be instructive?
Well, obviously the experience, a successful experience, which is what we have here, could be a model for the country. One of the issues that has been discussed, and we've discussed this in great detail at the level of the White House Coronavirus Task Force, is that there is such a degree of variability of accepting mandates throughout the country that the question does arise of how would you enforce the mandate if you had an awful lot of pushback for it? If the citizens of a particular state, a city, a county, or what have you, are really in lockstep with the authority that does it, there's not a big problem, as you've seen with the success in Vermont. However, there is a great deal of variability throughout our country, and in some areas, anything that smacks of an authoritative statement to the citizenry often is met with a considerable amount of pushback. So I think you'd have to say you have to take it on a case-by-case basis, which means the bottom line answer to your question is that a national mandate probably would not work.
We'll now go to Greg from the Bennington Banner.
Hello, and thank you for being here, Dr. Fauci. Dr. Fauci, you've served under 6 presidents and through significant public health challenges. In your experience, what does a healthy relationship between government, politics, and science look like?
Well, there's a great deal of variability and a great deal of difference from administration to administration because the challenges were really quite different. And it really depends, in fairness to any given administration, to the level of divisiveness that there is in the society. And divisiveness, I mean political divisiveness. When you have everyone pulling together and you leave the kinds of decisions that we're talking about to the scientists, and there's very little disagreement on whatever side of the political spectrum you're on, things work very well. However, when you have a situation of a combination of inherent divisiveness in society, a lot of politicalization during a climate such as an election year, where it really brings out differences among group, it makes it much more difficult than in other situations that I have found myself in when we were challenged, such as with the anthrax attacks following 9/11. There was total unanimity in the country about what needed to be done. The same thing holds true with HIV. Although there was some conflict of stigmatization, there was a universal push that ultimately led to a very, very successful approach, particularly in the arena of therapeutics for HIV. So again, the short answer to your question is that it really differs from administration to administration, but in fairness to any given administration, it also refers to the climate, the political climate that you happen to be in whenever you're in a particular situation like a public health challenge.
Go to Gordon from the Rutland Herald.
Good morning. Building a little bit on Wilson's question from the AP, a lot of people want to attribute our low infection rates to our population density, but we don't rank nearly as low in population density as we do in infection rates. Are we an outlier, or is there no real correlation between the two?
Well, there is some correlation, but as I mentioned in the beginning of this briefing, when I followed Governor Scott's delineation of the numbers, this is success because of what you did and not success only because of the low density in Vermont. You correctly pointed out that the degree of success is greater than the degree of low density. And we've seen some places of high density succeed. I mean, for example, although New York City has gotten hit really very hard, and as you remember, there was a period of time back then when more than 50% of all the infections and all the hospitalizations and even the deaths were focused around the metropolitan area of New York City. Now in New York City, they've got it right. They have their percent positivity not quite as low as you all in Vermont, but really quite low, to around 1%, which is that low baseline that I'm talking about. So it isn't a question of density or not. It's the question of what you did or did not do correctly. And from the numbers that I've seen, Vermont has done it correctly.
We'll now move on to John from VPR.
Thank you. Dr. Fauci, do you think lives would have been saved if Bob Woodward had gone public back in February or March about what he had learned about the president's thinking about the severity of the pandemic, or if the president had sounded the alarm earlier?
You know, obviously, that's a very politically charged question. I really don't think that you can make those kinds of direct extrapolations, because on every public health crisis that I've ever been involved with, and as the governor says, it goes back, to 6 administrations back to the early 1980s. You could always say what would have happened, should have happened, or could have happened. And I think that is not productive, because all it does, I think, is intensify divisiveness. So my feeling is always, when I get asked that question, and I don't want to be waffling away from it, but it's best now to look forward about what we know now and what we've been through and how we could best address it. So rather than looking backward and counting the number of hospitalizations or deaths that could have been saved, I actually prefer to look forward and say, we're entering into the fall and the winter. I really want to see as many states as possible do that with as low a test positivity as possible, similar to Vermont. Because if we do that, we can come out at the other end of this. Because when we get a vaccine, and let me get to that point because we haven't mentioned it yet, which I think will be, knowing that we have a safe and effective vaccine, by November or December with availability of doses by January, February, if you combine a low rate the way Vermont has with a vaccine that has a reasonable degree of effectiveness, i.e., 70, 75%, I think as we get into 2021, we are going to be in good shape. And that's what I'm hoping for. It's aspirational, but I think we can do it.
Thank you.
Now go to Andrew from the Caledonia Record.
Yes, good morning, Dr. Fauci. My newspaper covers what we call the Northeast Kingdom, which is the most rural corner of Vermont and has some of the lowest total cases as well as cases per capita in the state. So first, if you need to get away from it all, please consider this a standing invitation. I'm wondering, though, what message do you have for people in low-case regions like ours that may become complacent about sustaining safety protocols? And do rural regions have any unique vulnerabilities when it comes to the virus?
Well, I'm glad you brought that up because you gave me the entry to try and say something that I didn't want this briefing to go by without my emphasizing it. At the same time that I'm giving kudos to Vermont for doing so well, the message that I'd like all of the citizens of the state to hear is that this virus is a formidable foe. You give it an opportunity to reemerge its ugly head, whether you're in the beautiful rural area of Vermont or in the middle of Manhattan or the Bronx, that virus is going to take advantage of that. So please, you've done so well. Don't let your guard down, because if we do, we are going to see surges that are going to put us back to where we were months and months ago. This becomes particularly important as we enter the colder season of the fall and the winter. So good question. Let's everybody keep our guard up and not be complacent.
I'm going to use my moderator prerogative to allow another big fan of Dr. Fauci, Dr. Levine, an opportunity to ask a question or two.
Good morning.
Good morning.
Thanks for reinforcing a message that I've been trying to reinforce over many, many press conferences. And thanks from myself personally and from Vermonters for all the qualities you've just shown us during this short time with you. Your leadership, your placement of science over politics, and your staunch focus on protecting the health of everybody in the country. I'd like to pick up on the vaccine theme a little bit. Frankly, I'm surprised I get to ask this question because I thought you would have had 5 or 6 already about vaccines. But clearly the buzz around the country is confidence in the safety and efficacy and in the scientific process regarding vaccines. Can you help Vermonters understand the research and the process of vaccine development and take them through this process at the federal level and tell them why they should trust the eventual vaccine that comes out of these trials?
Yeah, thank you very much, Dr. Levine. That's a very important, and I'm glad you're giving me the opportunity to talk briefly about this. So the process of vaccine development is a scientific process that's ultimately decided at the end by a regulatory decision. We right now have 6 candidate vaccines that are in various stages of clinical trial in the United States. We're not the only country that's testing, but we have a number of candidates. They have gone into trial quickly, but I want to emphasize to you all that the speed was because of very sophisticated technological advances that have allowed us to get a vaccine from the sequence of the virus, which was published on January 10th by the Chinese, into a phase 1 trial within a period of months rather than years, and into a phase 3 trial that started on July 27th with 2 of the candidates and mid to end of August for the 3rd candidate. The 4th will go into phase 3 trial at the end of September, and the 5th and the 6th as we get into the fall. So getting to Dr. Levine's question, what about safety? there are multiple layers of checkpoints regarding both safety and efficacy. So first of all, every trial has what's called a data and safety monitoring board that intermittently at predetermined points looks at the data carefully. They do it independently of the government, independently of the company, and independent of the regulatory authorities. They are a group of scientists, statisticians, ethicists, and others. And what they do is they say there's 4 possibilities. You look at what's going on in the trial and you say, we don't have enough data for a decision, keep the trial going. Second possibility, the data looks so even between the placebo and the experimental that you're never going to get an answer, so you might as well just stop the trial. The third possibility is that there's a safety signal here, so wait a minute, be careful, we're either going to stop the trial or delay it. And then the fourth is the data are so good that we don't even need to go any further. Let's just get this thing approved. So you have an independent body. I think a good example, and Dr. Levine is very familiar with this, recently there was a serious adverse event in one of the trials. Immediately, the trial was put on pause, which I think is, one, concerning that there was a serious adverse event, but encouraging to know that we were looking at it really carefully, and we stopped the trial to look at that. Now, as we proceed, the question that I think underlies Dr. Levine's concern is that will there be political pressure to push a vaccine through that might not be proven to be truly safe and truly effective? In addition to the Data and Safety Monitoring Board, you have advisory committees to the FDA, and the FDA's pledge that they will not put a vaccine for approval unless it's clearly shown to be safe and effective. And the final thing you put on there is you have the scientific community, like myself and Dr. Collins, who's the director of NIH, who very carefully look at that and are not shy about giving our scientific opinions. So I would think that we trust the FDA. They have pledged that they will do what the science tells them to do. So I can tell you, based on my experience and what I'm seeing, if there's a vaccine, which I'm fairly certain there will be, that's safe and effective, I, for one, would not hesitate to take it, nor would I hesitate to recommend that my entire family do it. So I feel good about it.
Thank you.
Well, again, Dr. Fauci, we know you have a hard stop at 11:30. We could keep you here for the next couple of hours asking you questions, but we're grateful for your taking the time to speak to Vermonters, reinforce what we're doing, what Dr. Levine and the entire team is doing, as well as what Vermonters have accepted. And I give all the credit to Vermont and the people of Vermont for our success. But I thank you for reinforcing that, and we look forward to you coming up here to visit and explore the Northeast Kingdom, and we'll give you one of those maple creamies when you do come up. And if you need a place to bring your family that's safe, you know our numbers.
All right. Thank you very much, Governor. I appreciate that. I appreciate your Office of Hospitality. I am an avid ice cream fan, and I look forward to putting some of that syrup on there. Thank you, and congratulations on doing a terrific job with your state. And thank you for the opportunity of joining you today.
Yeah, thank you again. Have a great day.
You too.